Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, epilepsy is a disorder in which nerve cell activity in the brain is disturbed, causing seizures. Epilepsy may occur as a result of a genetic disorder or an acquired brain injury, such as a trauma or stroke. So today in our episode, we have with us Dr. Sudhakar Pandey, neurologist from GNRC Hospital, to talk more on epilepsy and seizure. And not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, Dr. Sudhakar Pandey, thank you so much for coming to Good Life, the health show. So today, the topic which we have taken, it's seen very commonly in these days in every household, and it has been a talk of the town, which we can say epilepsy or seizure. So first of all, I would like you to introduce the subject to our viewers in their manner which they can understand.
So if we define seizure, then in medical terms it is defined as paroxysmal event due to abnormal hypersynchronous discharge of neurons. So for common people to understand, seizure is basically an abnormal jerky movement of the body which is sudden in onset and offset. So usually it lasts for 2 or 3 minutes. So for common people, whenever a patient is having jerky movement of the whole of the body, it may or may not be associated with loss of consciousness, is defined as seizure. And whenever seizure is there, then the first thing is that you have to do is you have rush to hospital.
Okay, so one or the other, these are some of the common things which one has to take care of it. And doctor, is seizure and epilepsy common, or it is differentiate, and one can differentiate in both the terms?
Basically, a seizure is an episode of abnormal hypersynchronous discharge of neurons. And if there are more than 2 seizure episodes, which are more than 24 hours apart, and it is mostly due to some chronic underlying process, so it is defined as epilepsy. For common people, if patient is having multiple episodes of seizure, then we can call it as a epilepsy.
Okay. All right. In between of our show, I would like to tell our viewers that our phone lines are open and the numbers are flashed on your television screen. So if you have any queries regarding the topic which we have taken today, that is epilepsy and seizure, so please do call us and ask a question. Doctor is in our studio to give you all the answers. All right, doctor, coming back to you again, epilepsy and seizure, a brief idea. I'm sure the viewer must have got about it. So we already had a word on epilepsy and seizure. So let's talk about the different types of seizure.
Yes, usually the seizure is defined as 2 types commonly. One is focal seizure, in which we can say that patient is having abnormal jerky movement of the body, but consciousness is preserved. Means patient is conscious and he or she is having abnormal movement of the body. And in second, which is generalized seizure, in that case patient is having abnormal jerky movement of the body and it is mostly associated with loss of consciousness. Means patient is having abnormal jerky movement, he is having loss of consciousness, then we can say that patient is having generalized seizure. And if there is abnormal movement of the body and patient is having full sense, then we can say patient is having focal seizure.
Okay, so these are some of the common types which we can say. So how to differentiate between these, like how will a common man at home, staying at home back, or the relatives or the parents out there, how will they come out that the person is having those signs and symptoms of seizure? So what are the common signs and symptoms of seizure?
If like a patient is sitting quite alert at home and out of sudden he or she is having abnormal jerky movement of the body first, and then it can or cannot be associated with like incontinence of urine, tongue bite or frothing from mouth. And it is mostly associated with uprolling of eyeball, like patient will have uprolling of eyeball, frothing from the mouth, then incontinence of urine. These all are the common features of generalized seizure.
Okay, we'll come back to that common features. Doctor, we have a phone call, so let's take the phone call and then we'll proceed with the conversation. Hello?
Hello, মই আপোনালোকৰ অনুষ্ঠানটো চাই আছো জানিব বিচাৰিছো আপোনালোকে যেটো সাবজেক্ট লৈছে সিজাৰ বা এপিলেপসি এইটোত কেনেকুৱা ধৰণৰ মানুহবোৰ খুব সোনকালে আক্ৰান্ত হয় কেনেকুৱা ধৰণৰ মানুহবিলাকৰ হয় এই বস্তুটো বেছিকে জানিব বিচাৰিছো
Okay, so who are basically the patients who are being more attacked by this term seizure and epilepsy? That is the question which has been asked by the viewer.
It depends on basically seizure or epilepsy is having a lot of.
It's better like we can just reply to the convenient language which she can understand.
सीजर और एपिलेप्सी के बहुत सारे कारण होते हैं, वो एज और पेशेंट की और बीमारियों पर निर्भर करते हैं कि किस तरीके का उसको एपिलेप्सी है और उसमें किस मेडिसिन का सेवन करना उचित रहेगा, उसको डिफाइन करने के लिए बेटर है कि आप किसी भी नियर बाय न्यूरोलॉजिस्ट से कंसल्ट करें और उसको डिटेल हिस्ट्री एग्जामिनेशन और सारी चीज़ों को इवेल्युएट करने दें। उसके बाद वो डिसाइड करेगा कौन सा मेडिसिन किस पेशेंट में स्टार्ट करना है और कब कब पेशेंट को फॉलोअप में रखना है।
All right, I'm sure the viewer who have just asked the question must be benefited with the answer. And if you find any signs and symptoms which we are touching the topic right now and we are proceeding with that conversation, so please immediately go and see a doctor and find out the solution for that. You should not wait until it is too late. All right, doctor, coming back to the signs and symptoms, the basic signs and symptoms which a person will come out and will immediately go and have a check with the doctor.
Yes.
Okay, so what are those signs and symptoms like if just we have a brief idea. Like suppose a person is sitting
and he or she starts abnormal jerky movement of the body associated with frothing from the mouth, incontinence of urine or tongue bite, then you should think about patient might be having seizure episode, and then in that condition you should immediately rush to nearby hospital. Meanwhile, there are two things which you have not to do. Do not put anything in mouth, which commonly people do, like putting water or something else. Second thing, you have to make patient lie down on lateral side position just to prevent aspiration, so that patient is not having further pneumonia or something like that.
Okay.
And meanwhile, you have to rush to nearby hospital for further management.
Okay, so these are some of the tips one should keep in mind that if you find any signs and symptoms, so what are the things you should do and what are the things you should not do. So these are some of the points you should mention and you should note it down, viewers. All right, doctor, let's talk about the febrile seizure. What is that febrile seizure all about?
Yeah, very interesting and very commonly seen in childhood age group. What happens in this febrile seizure, when child is having fever, then during that fever episode, they can have seizure episode. And it is usually seen from 3 months of the age to 6 years of the age, and it is basically of two types. One, simple febrile seizure, in that patient can have seizure episode up to 15 minutes and they are having more or less other neurological finding normal. And second one is complex febrile seizure. In that case, they are prone for further occurrence of epilepsy. So they should be followed closely for further development of epilepsy. Okay. So and the management is immediate management of this fever, and if patient is having persistent seizure episode during fever, then you can go for some anti-epileptic in the form of intranasal midazolam. And that is going to cure this febrile seizure. But if they are not being improved by taking that medicine, then you should consult immediately to doctor.
So does any unusual activity has been seen in this long period which you have mentioned in the childhood for this febrile seizure? So any unusual activity can be seen by the parents at home, by the person who has been attacked?
Yes, like patient, like child is having fever.
Okay.
And then during that fever episode, he or she is going to have this abnormal jerky movement.
Okay.
So mostly it is generalized seizure, so they are going to have loss of consciousness
so
also.
Mostly the signs and symptoms are basically the same in...
but it is associated with fever.
Okay, it is associated
if fever
with
is there and patient is having seizure, then you have to think about febrile seizure.
Okay.
And you have to take care of that by consulting neurologist, and they will prescribe medicine if required.
And there is also a first aid episode during a seizure. So
Yes.
the first aid episode, the first thing anyone needs to do is, what is that?
Again, I am going to emphasize that what you have to do, what you have not to do.
So
what
there
you
are do's and don'ts.
Yeah.
Okay.
What you have to do is immediately, whenever patient is having seizure, maybe you are going on a street and somebody else who is not related to you, he or she is having seizure episode, abnormal jerky movement and frothing from mouth, then you should think that my patient might be having seizure, and immediately you should go with him and you should have to go for turning up the patient immediately.
Okay.
So that he is not in supine posture. He should be on lateral turning posture, and do not put, please, do not put anything in mouth.
Okay.
What happens in most
water.
of the, they will put some water, they will put something else, and that patient is going to get consciousness. But that is going to harm rather than helping patient.
Okay, so that is going to harm. So not to put anything inside the mouth, and immediately should lie down the patient
On lateral posture.
lateral position, and immediately should find a hospital and just transfer him and for the personal
nearby
diagnosis.
hospital.
Nearby
you have
hospital.
not to wait for you have not to go for very long distance to attend hospital. Nearby hospital you should immediately consult and they will manage patient.
So do's and don'ts. So there are other do's and don'ts which one has to take care of, doctor?
Like if patient is a known case of epilepsy,
Known case.
then in that case there are a lot of precautions which are to be taken by patient. Like if patient is having seizure episode today, then at least for next 6 to 12 months, they have not to go for driving. They have not to go for any high risk activities like this swimming, like some like individual activities, trekking. So these all things should be avoided in seizure patient.
Okay, so these are some of the precautionary
Yeah.
measures.
And along with this, they have to take proper care of diet and they should take proper sleep. So these and as much as possible they should avoid stress. And most important thing is whatever is prescribed from doctor, they have to take it continuously without break.
Okay, so doctor's prescription has to be followed very strictly.
Yes.
Unless and until your doctor says to stop those medicines or ask you to change your medicines, you are not to change your medicines.
Yes.
Because we have seen that if you find yourself well, you immediately stop medicines. And
Most often
most
happens.
often we have seen this in our society. So what are these suggestions? What, as a doctor, what suggestions do you want to give those patients that you should not, unless and until it's consulted by your doctor, you should not immediately stop your medicines?
My suggestion to all the viewers is that please do not stop anti-epileptic medications by your own. Always consult your doctor. Even if you are having some side effect with that medication, you should consult to your doctor so that they can modify medicine. And there are different medicine for different type of epilepsy. This doctor is going to decide which medicine you have to take and which medicine you have not to take. Whatever problem you are having with that medicine, or even after taking medication you are having seizure episode, immediately consult your doctor and he will modify medicine accordingly. But do not self-medicate, please.
Yeah, do not self-medicate yourself, and doctors are there to help you out with all the problems you are facing, and they will find the solution for you. So doctors are there, and doctors like you are there to guide us also, and we are giving information, and we have to be informative to our viewers as well.
Yes.
Because always we select a topic that helps the viewers to understand it, because the terms which we use is of medical term, but we make them understand in their language, which is convenient for them, which is comfortable for
Yes,
them.
very good.
All right, doctor, let's talk about the causes of epilepsy. If we talk about the causes of epilepsy.
If we talk about causes of epilepsy, then it can be broadly of two types. One, idiopathic epilepsy, and second one is symptomatic epilepsy. So as the name suggests, in idiopathic epilepsy, mostly they are having generalized seizure and cause is not known.
Okay.
So in that case, what very important thing is that you have to continue medicines for indefinite period.
Okay.
In other part, like if patient is having symptomatic epilepsy, then if there is correctable cause, then you can go for correction of that cause, and then maybe in due course of time patient is going to this stop medicine. So basic category is idiopathic and symptomatic epilepsy.
All right. So these are the two manners and two causes, main causes.
There are a lot of
There are
categories.
a lot,
I am
but
not going
these
to
are
detail for
generic.
that.
These are
Yes.
generic, which one can find and may generalize themselves and may find out in any household. All right,
Yes.
doctor, in that mode, we have to slip into a short break. All right, viewers will slip into a short break, but do come back soon because we have lots more on the other side. Welcome back. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on seizure and epilepsy. So let's proceed with that. And Dr. Sudhakar Pandey is in our studio to guide us in this entire episode on epilepsy and seizure and causes and symptoms about it. All right, doctor, coming back, let's talk about the childhood epilepsy syndrome. We have heard about that term. So
Yes.
what is it all about?
Actually, there are a lot of childhood epilepsy syndrome, but I will be discussing about two, which are very important and very common. One is juvenile myoclonic epilepsy.
Juvenile myoclonic.
What happens in it is having a multiple type of episodes, and a patient are having like generalized seizure, then absence seizure, then sometimes they are also having myoclonic seizures. So there can be combination of these all types of seizure episode, and they are having very good response to treatment. So whenever a child is having this multiple type of seizure episode, you should consult to doctor and they will give some very good medicine, and they are having very effective treatment. But again, in this condition, you have to take these medicines for indefinite period.
Okay.
Because they are having chances of recurrence when you are going to stop medicine. Second one is childhood absence epilepsy. It is very important to understand that sometimes a child is having poor scholastic performance. They are not having full concentration in studies. So what happens, parents think, okay, my child is not going to study, okay, we will go to some psychiatrist for evaluation. That is okay. But what happens in childhood absence epilepsy, they will have frequent blank and frequent like absences, like they are seeing something and they are just having blank staring
Maybe
look.
not able to concentrate on certain things.
So that's why they are mostly having poor scholastic performance.
Absolutely.
And in that case, if you consult with doctor and there is very good response to medicine and they are having very good response after taking medicine and they are almost completely all right. And in due course of time, by second decade, most of them are going to remit. So they will not have any problem after second decade.
But doctor, talking about the second syndrome, what do you think, what is the role of the parents in this? Because the confidence building, morale boosting is one of the, and the consultation, and nowadays we have seen a lot of talks are also done on these methods, and so that the child will gain confidence. Maybe a good number of like parenting is also very important in this, and love and affection is one of the main factor which is which can heal, which the medicine cannot do, I think.
Definitely, that is definitely going to have a lot of role, and parents should understand that every poor scholastic performance is not due to some like lack of concentration of this child. There can be some other reason. So it's better to consult doctor. If there is nothing abnormal, then definitely you should go for
if it is happening frequently, if there is nothing development or if there is a nothing problem with the child, then there is something or the other reason which parents should find out. But this is one of the things which we see in society, that they don't come out in open. They don't come out in open to talk about these things, that they feel shy or they feel hesitation in that mode of time that my child might not have this problem, but maybe they are having this problem and that has to be found out and solution has to be found out because the child is suffering.
Actually, I just want to have a brief description of one patient I was having in my OPD.
Okay.
She had just poor scholastic performance. Age of child was, I think, 8 or 9 years. And every time the complaint of attendants was that she is not having this mind in studies and she is mostly having lost look.
Okay.
So I went for complete evaluation, including that imaging and other things.
The history.
Yes. And then I find out maybe child is having this this childhood absence epilepsy, and after investigation and everything, she was diagnosed to have this absence epilepsy, and I started treatment, and now she is fine. She's having very good scholastic performance.
So what was the procedure you
and
do, and what was the
parents
treatment?
are very happy. Okay, sir, you have done a miracle. So important is that you have to go for correct diagnosis,
right?
And correct diagnosis can be made by correct people.
Miracle happened because you found out the reason behind what exactly was happening with the child, and then the solution was found out, and then the miracle happened. And these kind of like developments and these kind of like episodes, they give you a lot of like immense pleasure, doctors, isn't it?
Definitely.
Like when you find out that the parents are happy with the development, parents are happy with the procedure which you have gone through, so they find it very informative, and they also maybe tend to tell other people as well that you should also take care of your child. So this gives you immense pleasure.
Definitely. If patient is happy, then we are happy.
All right, so lots of such examples surfaces around your society as well, viewers. So if you find, not only at your home, but also if you find anything around your society, you're finding a child and not feeling good, or find your, maybe your child studying in a school and the fellow student is not able to concentrate. So maybe there might be some reason behind it, but you should immediately have a talk with your fellow people and also have a talk with the doctors to get an idea about it. Doctor, we have a phone call. So let's take the phone call and proceed with our conversation. Hello.
Hello.
Apna prashna to koribo. Hello.
Hello.
Hello. Apuni doctor lor kiba kotha patibo bicharise?
মই মহলৰ পৰা কৈছোঁ।
প্ৰশ্ন to koribo?
মোৰ তাৰমানে প্ৰব্লেম কি হয়
আপোনাৰ টিভিৰ ভলিউমটো অকমান কমাই লব, তেতিয়া আমি প্ৰশ্নটো ভালকে শুনিব পাৰিম। প্ৰশ্নটো কৰক।
তাৰমানে মোৰ কি অলপ সুগাৰ প্ৰব্লেম আছে।
Okay. So he's basically talking on diabetic part. Sugar problem. প্ৰশ্নটো কৰিব?
মইতো কমাই দিছোঁ।
All right. Thank you so much for calling. So basically, the caller was asking on the sugar and the diabetic part. So actually, we are having a fruitful discussion on seizure and epilepsy. So I'm sure you must be benefited, and you will be benefited by the topic which we have taken. And the phone lines are open, and its numbers are flashed on your television screen. So viewers who have just asked the question, you must always go to a diabetologist and query about your problem which you are having, and I'm sure you will find a solution on that. Thank you so much for calling. All right, doctor, coming back to you again. So the immense pleasure when you see something good has happened and something successful has happened with the patient. So there are lots of stories which you have gone through in your medical practice as well.
Yes.
So let's talk about the management of epilepsy, doctor.
Management, actually, whenever a patient of epilepsy is coming to me or any doctor, then the most important part is history. But again, when patient is having generalized seizure, then patient cannot give history what happened at that time because he was unconscious. So history from patient if it is focal seizure, and history from bystander or family member what happened actually at that time of the seizure. Or if you can ask for video of that event, if attendants are very keen and educated, they are going to make a video of that event, and if they are having that video, just see that video and it will make diagnosis immediately correct. That what happened actually at that time. And then definitely examination part, you have to examine patient in detail, and then comes investigation. There are three important investigations. One, blood investigation routine. Second one is imaging in the form of MRI or CT, whatever is available with you. But MRI brain is preferred because if there is small lesion, then you cannot get it detected in CT scan. Then third part is EEG, electroencephalogram. This is cornerstone investigation for epilepsy patient, and depending on the abnormality, we can diagnose that which type of epilepsy patient is having, and there are different characteristic finding in EEG. By that way we can define and we can start treatment of patient. Then when investigation is done and we define that which type of epilepsy patient is having, then we have to start treatment. And there are different medication for different type of epilepsy. And then again we have to counsel patient, then you have to take these medicines for a long time, and medicines are having side effect. If there is any abnormality, any problem occurs after taking medicine, you have to report to us. Do not stop medicine by your own. Come for regular follow up. If medicine is causing any problem, contact doctor and let him or her know that there is some problem with medicine. They will modify that medicine simply.
Okay, so these are some of the management of epilepsy, and doctor, we are running short of time. So I would like you to tell our viewers what are the key points one has to keep in mind about epilepsy and seizure, and if at home, if they find any kinds of signs and symptoms among their family members, or maybe they are thinking that this might lead to seizures, so what are the things they should do and they should not do?
So if a patient is having seizure or epilepsy, then first and foremost important thing for family members is that you have to recognize it is seizure, and then immediately you have to do, what you have to do is just make lie down of the patient on lateral side, and you have not to put anything in mouth, and immediately rush to nearby hospital first. And if patient is on regular treatment for epilepsy, then you have to maintain that medicine on regular basis. Do not stop medicine by your own. If there is anything, any problem with medicine or anything is there, you have to consult to your doctor, and you immediately report that doctor, the patient is having problem with this medicine. Just consider that, and the doctor will rethink, and they can change the medicine to some suitable medicine. And but again, you have not to stop medicine because of side effect or because of some reason, like I prescribe medicine for 3 months and then you are coming after 3.5 months, and then you will stop medicine after 3 months, and you will say that, oh sir, doctor, you have prescribed medicine for 3 months. No, till you come next time, you have to continue same medicine and be in regular follow up. Whatever doctor advises, kindly follow the instruction given by your doctor.
All right, so kindly follow the instructions given by doctor. So doctor, let's talk about the lifestyle management also. Lifestyle management is one of the much important key point one has to take care of, because stress, depression, these are the keywords we always hear these days from everyone, everywhere. So lifestyle management, like proper exercise, proper diet management. So what are the things that these are some of the short and very much minimal and tips which you can give to our viewers as well?
Actually, there are few things which can precipitate seizure. Like if you are having decreased sleep, then it can precipitate seizure. If you are having undue stress, it is also going to cause some problem. If you are taking some medicine without taking advice from doctor, like antipsychotics, antidepressant, they are also going to cause this decrease in threshold for seizure. And even if patient is having good control of seizure, and by taking these medicine they can have seizure. So these all things should be taken in consideration, and whenever you want to take some medicine, you consult your doctor and take advice. And regarding this lifestyle modification, definitely if you are having a stress-free life, if you are having a regular sleep, your lifestyle is maintained, healthy life is there, definitely even if you have to take medicine, then medicine can be reduced and you will have good control of seizure after taking medicine. But if you are
it's all about, like, if you take a less amount of stress and less amount of depressed mode, and if you find yourself in the surroundings of good people, and if you find yourself in good surroundings of whatever life and likes you do, or whatever things you love to do, so that can also lead to the lesser amount of stress, isn't it, doctor?
Definitely.
So, doctor, we are really running short of time, so I hope that we wanted to have a more discussion on this. But thank you so much for coming to Good Life and having a fruitful discussion. I'm sure the viewer who have just watched our show must be benefited with the topic and the discussion which we have done today. So thank you so much for watching Good Life.